Number 25, sexually transmitted infections and HIV and AIDS. So first, let's talk about the risks with STIs. So some communicable diseases, such as cold and flu, can be transmitted through actions as simple as shaking someone's hand. Other communicable diseases are not as easily spread. Sexually transmitted diseases, STDs, also referred to as sexually transmitted infections, STIs, are infectious diseases spread from person to person through sexual contact. A person can have an infection and pass the infection to others without necessarily having the disease. So, STD is a hidden epidemic. Throughout history, people have been faced with epidemics, which are occurrences of diseases in which many people in the same place at the same time are affected. Today in the United States, we now are facing another epidemic, an epidemic of STDs. An estimated 65 million people in the United States are living with an incurable STI. Many of these cases go undiagnosed and untreated. Why would that be? Because many people with STDs are asymptomatic, means they're without symptoms. They do not seek treatment because they don't know they are infected. Individuals who don't know they are infected can continue to transmit STDs. Some people who suspect they have an STD may be too embarrassed to seek treatment. Also, when STDs are diagnosed, they may not be reported to the health departments so that contacts may be notified and treated. These contacts can continue to unknowingly transmit the disease to others. So let's talk about high risk behaviors and STDs. In the United States, teens make up 1/4 of the estimated 15 million new cases of STDs each year. That's more than 10,000 young people infected every day. Why are teens at particularly high risk of infection of STDs? Teens who are sexually active are more likely to engage in one or more of the following high risk behaviors. First, being sexually active with more than one person. This includes having a series of sexual relationships with one person at a time. However, being sexually active with even one partner puts a person at risk. Most teens are unaware of a partner's past behavior and whether he or she has an STD. Second, engaging in either unprotected or protected sex. Barrier protection is not 100% effective in preventing the transmission of STDs, and it is not effective at all against HPV. Abstinence from sexual activity is the only method that is 100% effective in preventing STDs. Third, selecting high risk partners. Such partners include those with a history of being sexually active with more than one person and those who have injected illegal drugs. And fourth, using alcohol and other drugs. Alcohol use can lower inhibition. In a recent survey, more than 25% of teens who engaged in sexual activity had been under the influence of alcohol or drug use. So, what are the consequences of STDs? Most people, including teens, are not fully aware of the consequences of STDs. These are serious infections that dramatically change the course of a person's life. Some STDs are incurable. The pathogens that cause these STDs cannot be eliminated from the body by medical treatment, such as antibiotics. The viruses that cause genital herpes and AIDS, the human immunodeficiency virus or HIV, for example, remain in the body for life. Also, some STDs cause cancer. The hepatitis B virus can cause cancer of the liver. The human papillomavirus can cause cancer of the cervix. These STDs cannot be cured and may last a lifetime. Some STDs can cause complications that affect the person's ability to reproduce. Females can develop pelvic inflammatory disease, or PID, which damages reproductive organs and cause sterility. Some STDs can be passed from an infected female to her child before, during, or after birth. STDs can damage the bones, nervous system, and brain of a fetus. Premature birth may result, and infants infected with STDs at delivery may become blind or develop pneumonia, and some may die. So let's talk about the importance of abstinence. You may have experienced how an action that has a result demonstrates a cause-effect relationship. Touching a hot stove, for example, is the cause of sustaining a burn, which is the result. A clear cause and effect relationship exists between sexual intercourse in any form and sexually transmitted infections. If you have sexual contact with an infected person, you put yourself at risk of being infected with an STD. Sexual activity is the cause and STD is the effect. Prevent exposure to STDs by practicing abstinence, which is the deliberate decision to avoid harmful behavior, including sexual activity before marriage and the use of tobacco, alcohol, and other drugs. Use refusal skills to avoid situations in which you may be at risk. Choose friends who are abstaining and who support your decision to abstain. So now let's talk about some common STIs. You've already learned why STDs are referred to as a hidden epidemic in the United States, which has the highest rate of STDs in the industrialized world. The Center of Disease Control and Prevention, the CDC, reports that STDs account for more than 85% of the most common communicable diseases in the United States. The most important fact to remember is the primary means of transmission of STDs is sexual activity. Teens who practice abstinence from sexual activity greatly reduce their risk of contracting STDs. Now let's go into specific STDs. So, human papillomavirus, HPV, is a virus that can cause genital warts or asymptomatic infection. HPV is considered the most common STD in the United States. The CDC estimates that 50 to 75% of sexually active males and females acquire HPV infection at some time during their lives. About 30 types of HPV can infect the genital area. Most types of HPV infection are asymptomatic. Pap tests and other medical examinations may detect changes associated with HPV. There is no treatment. However, most asymptomatic HPV infections appear to be temporary and are probably cleared by the immune system. Almost all cases of cervical cancer are caused by certain types of HPV. HPV also can cause cancers of the penis and anus. Next, genital warts. Genital warts are pink or reddish warts with cauliflower-like tops which appear on the genitals, the vagina, the cervix 1 to 3 months after infection from HPV. Genital warts are highly contagious and are spread by any form of sexual contact with an infected person. It may take up to 3 months for warts to appear, but they often disappear even without treatment. Diagnosis is determined by a healthcare worker by examining the warts. If a person suspects he or she has been infected, examination and treatment are essential because once infected, a person has the virus for the rest of his or her life. Treatments can rid the body of the warts but not the virus. Complications of HPV and genital warts can result in cervical cancer and cancer of the penis. Infants born to females infected with HPV may develop warts in their throats, obstructing their breathing passages, which can be life-threatening. Next, we have chlamydia. Chlamydia is a bacterial infection that affects the reproductive organs of both males and females. 40% of cases are reported in teens 15 to 19 years old. Chlamydia is asymptomatic, meaning that there are no visible symptoms in 75% of infected females and 50% of infected males. When symptoms are present, males may experience a discharge from the penis, burning upon urination. Females may have vaginal discharge, burning upon urination, or abdominal pain. Chlamydia is diagnosed by laboratory examination of secretions from the cervix in females and from the urethra in males. It can be treated with antibiotics, but no immunity develops so a person can become infected again. Because chlamydia is usually asymptomatic, it often goes undetected until serious complications occur. In females who are untreated, the infection can cause pelvic inflammatory disease, PID, and lead to chronic long-term pelvic pain or infertility. Untreated chlamydia can also lead to infertility in males. Chlamydia can cause premature birth, and infants born to infected females may develop eye disease or pneumonia. Genital herpes. Genital herpes is an STD caused by the herpes simplex virus, HSV. There are two types. Type 1 usually causes cold sores. Type 2 usually causes genital sores. However, both types can infect the mouth and the genitals. Nationwide, about 20% of the total adolescent population is infected with the virus. Genital herpes is twice as common in adults from 20 to 29 years old today as it was 20 years ago. Most individuals who have genital herpes are asymptomatic and not aware that they have been infected. Those who do show symptoms typically have blister-like sores in the genital area that occur periodically. It is not true that the virus can be spread only when the blisters are present. The virus can be spread in the absence of symptoms. Diagnosis is made through laboratory tests on the fluid from the blisters. Medication can relieve the symptoms but cannot cure the herpes infection. Once contracted, the virus remains in the body for life. The herpes virus is potentially fatal for infants who contract the virus from their mother at the time of delivery. The virus may also play a major role in the spread of HIV by making people who are infected with herpes more capable of transmitting and acquiring HIV. Gonorrhea. Gonorrhea is a bacterial STD that usually affects mucous membranes. The highest rates of gonorrhea infection are found in females from 15 to 19 years old and males 20 to 24 years old. Symptoms in males include a discharge from the penis and painful urination. Diagnosis in males is made by staining and examining the discharge under a microscope. Approximately 50% of females with gonorrhea have no symptoms. Those who do may experience a vaginal discharge and pain or burning while urinating. Diagnosis in females is made by swabbing the cervix and growing the organisms in the laboratory. Gonorrhea can be treated with antibiotics. However, increased resistance to antibiotics can complicate treatment. The person can be reinfected if exposed again to the bacteria. If untreated, gonorrhea can lead to infertility in both males and females. The bacteria can also spread to the bloodstream, causing permanent damage to the joints. Females can pass the infection to their babies during birth. Infants born to mothers with gonorrhea may contract eye infections that cause blindness. Next is trichomoniasis, is an STD caused by a microscopic protozoan that results in infection of the vagina, urethra, and bladder. About 5 million new cases of this disease are estimated to occur every year in the United States. Females may have no symptoms, however, the disease may result in vaginitis, which is an inflammation of the vagina characterized by discharge, odor, irritation, and itching. In females, trichomoniasis is diagnosed by microscopic examination of the discharge. Organisms can sometimes be seen in a pap test. Males usually have no symptoms. When symptoms do occur in males, they include mild urethral itching or discharge and burning after urination. Since the disease is difficult to diagnose in males, they are usually treated without laboratory testing if their partners are infected. Next, syphilis. Syphilis is an STD that attacks many parts of the body and is caused by a small bacterium called a pirochet. The first sign of infection is a painless reddish sore called a chancre at the site of infection. The sore will heal on its own, but if the infection is not treated, it spreads through the blood to other parts of the body. Eventually, the disease can damage internal organs, including the heart, liver, nervous system, and kidneys. If left untreated, the person is at risk of paralysis, convulsions, blindness, and heart disease. Syphilis can be transmitted from a pregnant female to her fetus. An infant infected with syphilis may have a damaged nervous system and can die from the effects. Let's talk about seeking treatment. So, seeking treatment, prevention of STDs is every individual's responsibility. Treatment is also an important personal responsibility. As I've mentioned, STDs can cause severe, long-term health problems. Being embarrassed should not stop a person who thinks he or she may have been exposed to an STD from visiting a private physician or a public health clinic. By law, information about these diseases is kept confidential. Only a healthcare professional can prescribe the correct treatment, including antibiotics for some STDs. Individuals also have a social obligation to prevent the spread of infection. Public health clinics sometimes help with contacting current and past partners to make sure they get any needed treatment. Ultimately, however, it is the responsibility of any person infected with an STD to notify everyone with whom he or she has had sexual contact. Informing someone else about the possibility of having an STD could save the person's life.